organized, it is a one-year program organized by our Indian Society of Pedodontics and Preventive Dentistry, which I am right now the executive committee member also. And I went, when I thought like I am a pedodontist, so I am very good equipped with dealing with special needs children. But when I went there, and it is a three module kind of a thing, and the fourth one is an exam, and where we need to present a couple of cases for thing, and it is not autism alone, it's everything covered about special needs. So then I realized, okay, I am learning something new, and whatever I knew was nothing. So just a part of it, I am going to share whatever I knew about it recently. If at the end of this program, if you can think differently whenever you see a child with autism, I think my program had done some justice to it. Okay. Regarding myself, I am Dr. Farzan. I am currently heading the department at Meenakshi Ammal Dental College for the last 8 years, and I am just walking the shoes of the great Dr. Shivakumar Nula, who is my inspiration in after I did my post-graduation. He is not my teacher. We have not worked together, but there is a lot of learning happens through him whenever we interact during exams or conferences. And now he is such like 20 plus years senior to me, but he is like my friend now. And I would advise Raghu to call him once for an enlightening lecture. Regarding myself, I did my BDS from Ramachandra in the year 2002. I finished and continued with my post-graduation from the erstwhile Annamalai University Raja Muthaya Dental College, where I learned what life is. Okay, and continuing that, I joined Balaji as a senior lecturer. Then I moved on to Meenakshi for 3 years as a senior lecturer. I had then moved on to my own alma mater, Ramchandra, and for 1 year as a reader, and then shifted immediately to Savita for another 3 years for as a readership there. Then from there, I took a break in my academics. I thought there's nothing more I can do in academics, so I went on to full-time practice. I used to practice along with Dr. M.S. Muthu. We were business partners in Pedo Planet, and I had a lot of learning through him as a leader, how to conduct yourself in the top position, and how systems are created to make things work. And suddenly something changed, and I got this offer of going to Venkateshwara Dental College as an in-charge, where I happened to work with Purni ma'am. And it was a part-time job kind of a thing, but still I was into full-time practice. And again, this offer of heading the department came in, and completely the life has changed. I had left practicing and went direct full-time academics, and recently I started my own small cabin or kind of a consulting room next to my house. This is about me, and I exclusively practice only pediatric dentistry, and recently I have started doing some sedation under nitrous also for adults, especially for impactions and flap surgeries. I play the role of the anesthetist. Okay, this is about my recent interest in nitrous. With regard to special needs children, I told already how I came into it, and let's go into the topic into detail. I would like to have some questions to be answered from the audience. What comes to your mind when you hear the word autism? I need answers, because this is the content of the lecture which is going to change your thinking.
Not cooperative, moving around, disturbed.
Autism, they are special because they are not like us. Right? How many of you have treated any child with autism spectrum disorder in your dental practice? Treatment done? Okay. Do you think, is it rare?
If the parents are not identifying the child is autistic, probably we may also may not be
Yeah, it happens many times. Many times it happens, and the recent concept of virtual autism is into play, where it's because of your prolonged screen time. They are normal children where they behave like autistic. Okay, that's a different topic. Let us focus on. Do you think? I'm coming to the topic. I'm just trying to gather your knowledge before I went into it. Is it rare or common?
As we go into autism, can you help us understand like autism and attention deficit disorder?
It's completely different. Different. Okay. Attention deficit disorder are like normal children with hyperactivity, they don't listen to you. Autism is completely a different topic. Okay. Do you think it's rare or is it common? Is it increasing? Why do you think it's increasing?
Electronics.
No, that is a different thing.
Parents stressed out during pregnancy.
Okay, we'll come to the topic. Okay, why do you think that two children with the same diagnosis of autism behave differently? Have you seen children with many children with autism? At least two, they are completely different, right? So autism is not it cannot be defined as this is what it is. That is why it has different types of manifestations depending upon the child's involvement with the condition. That is why they put this into autism spectrum disorder. It is a spectrum. Spectrum means a wide variety of manifestations will be seen with respect to autism. But basically each child is different. The moment you interact with their parents, they will be able to tell you that what kind of behavior or how they are interacting with them, which you can pick up before the treatment and try to inculcate in your practice in order to deliver your care. Okay. Why are these questions? First is, it is definitely common. It is not rare. Previously, it was not diagnosed. It was there. But the technology, the understanding, the awareness was not there, so we are not able to pick them up. You would have seen in your in your younger childhood days, your neighbor or your next street, somebody will be like abnormal. But they will not tell, we will not be able to define them, they are autistic, but you will definitely would have seen somebody who is like not normal. It is not diagnosed because there is no knowledge about it. Even the clinicians or the medical practitioners didn't know about it. Once they started knowing more about it, now the number of people we are recognizing is coming more. It was there, we didn't see it. Every autism spectrum disorder child is different. If today I am seeing one child with an autism, it doesn't mean that the same kind of a child with autism is going to come to my clinic next day. Okay. It has to be tailored specific for each and every child, whatever you are going to do. It is not the behavior what they make inside your clinic. It is not something which they don't like. That is how they are. They are trying to communicate. If they are flapping their hands and coming, that means they are trying to tell something to you. That is the way they are communicating. If they are making some sounds which is annoying to you or whoever is there, that means it is not that they are not liking the place or not liking you. That means they are trying to communicate to you in their own way. Okay. Usually it is like connections in the brain. We all have wirings. Just consider your brain has many parts and everything is connected. It is not connected in the same way. It is all jumbled. Okay, they may be good at one certain connections will be weak. So that is what makes them to behave like that. So you need to consider them as same as what we are or our children are, any other people in the community, and try to include them also in your society. That is what inclusivity comes in whenever you deal with special needs children. And especially dental settings where you have bright lights, noises, the smell of the dental clinic with eugenol or whatever material you are using, and new faces. These are all little startling from them when they come in the first visit. So you need to get accommodated. They are like any other children, but you need extra care for them to get accommodated in your clinic. I hope this set the pace of my presentation. Let's go into our approach has to be different. I wantedly put this because you have to think out of the box when you are treating such children. Not always you need to do GA for children with autism. First you take that out of your mind. There are a lot of other preventive strategies you can employ whenever you encounter a child with autism. So what is autism? I am coming to that question. It is a neurodevelopmental condition characterized by differences in communication, social interaction, and behavior. I think at some point of time in our life, we were also autistic. Right? When we are growing up, we did have difficulties in communication. Later we learned and we changed. We had difficulties in social interaction. If I see somebody who I don't like, I never go to them and talk. Right? That is difficulty in having a social interaction. That means you don't like them means you don't like them forever. But you can change. Change your mindset. You can go and talk to them and establish the contact again. Same thing with behavior. We see this every day whenever we drive on the road. If you want to classify everybody according to this definition, then whoever is driving on the road is autistic. Right? So consider everybody as the same, only thing their level of understanding, their level of communication, their level of interaction is different. It is a spectrum disorder, as I told. It is not one condition, it is various conditions together. If I have to talk about autism, this itself we may have to take the whole day about autism. Okay, the whole course I told is for 1 year. 3 modules, each module 3 days. Okay. It's not a disease. First of all, you understand it is not at all a disease. It is a condition. You may have something in your, it is like having an extra finger. It is a condition. You can have a hole in your heart. It is a condition. It is not a disease. So something they have born with, you have to accept and move on. And regarding etiology, don't think that is the mistake of the parents, is the mistake of the genetics. Never ever think about it. Anybody can have autism any point of time. It doesn't make any sense. There is no cause which has been related to it till now, why it is happening. It is happening, that's it. The core features are, they are very bad in social communication. When trained well, when you know how they communicate well and understand their communication methods, you can definitely communicate with them. Their repetitive behavior or restricted interest makes them look different from the rest of us. And there is always a sensory processing differences. I would like to come here and ask you a question. How many senses do we have? 5 senses. 6th sense is different. So what are the 5 senses? Eyesight, smell, hearing, touch, taste. I would say there are 8 senses. If you understand these 8 senses, you can understand them very well. Okay? You have the auditory sense, that is your balance, right? You have that sense. We have all that sense of balance. They don't have the sense of that balance. Few of them don't have. Then you have two more senses which is related to their communication. If I am going into detail, it will be very difficult to understand, but make you understand that there are 8 senses. Okay? This is how it is. Your environment and their environment is completely different. They are with us, but in a different world. They see the world differently. You have the visual sense, auditory sense, then vestibular sense, that is your balance, your tactile sense, your odor sense, and taste sense. How many of you employ all these factors in your clinic to engage these children, even a normal child? If a child is coming and misbehaving or scared, are you using any of these senses to manage them in your clinic, to make them cooperative? Do you use any strategies? For visual sense, you can show them cartoons. For auditory, play some nice music. For adults also. But we don't use anything for odor or taste, right? But these children are very strong liking to these senses. Okay, some might like a specific sense of smell, which they feel comfortable when they are in that environment. So you have to create an environment where they'll get that smell in your clinic. I may be liking lavender. He may be liking lemon flavor. Same way, the child will have some sense which is good for them. You inquire with the parents, they will be able to tell what is their sense of smell which is making them comfortable at home. You can create that in your clinic, and when they are coming in the clinic, you can produce that, and they will be calmed down and they will listen to you much easier than anything. Okay, for that you need extra equipments which delivers this kind of smell. Regarding the visual sense, these children are very not so good at bright lights, so don't ever switch on your dental light when they are first sitting on the chair. Okay, you may use a small pen torch, just focusing only on the tooth and try to examine them. Don't ever use the bright light. And nowadays there are special environmental changes inside the dental clinic, that is called SADE. SADE is a term which is sensory adapted dental environment. This is a new type of concept wherein we create one of our rooms into incorporating all these sensors into it, so that according to the patient's need, we create those sensors in that like this light. Okay, all the bright lights are switched off and various colored lights are given. No, like these stars in the sky, and it is kind of a disco room. That's what I will say. Okay, so if that child is liking that kind of environment, you provide that. Okay, that's here. This is what I want to make into your thinking, that we are not only 5 senses, we have more than 5 senses. So when there is a lot of all this yearly intervention, when they are going for treatment, when they find it, they try to accommodate those children with these senses. They try to find out which one they don't like, which they like, and try to teach them accordingly. And when you are inquiring with the parents, they will be able to tell you, so that you can use that in your treatment. Let us see how far autism is prevalent. It's 1 in 100 children worldwide. That's a very large number. It is rising because better awareness, screening and diagnostic criteria. In India, it's about 1 in 65 children between 2 to 9 years may have autism spectrum disorder. We have more autism spectrum disordered child in our country. But this estimate is not so perfect because of our demographics. The key points is it is not rare. The prevalence is increasing because of diagnosis improvements, and there are many cases which is undiagnosed. You may be the first person to diagnose also. If a 2-year-old walks into your clinic and you see that they don't have your eye contact, they don't verbalize their emotions. So what is the impact of autism on child development? Definitely their learning is impaired, their social life is impaired, their language, that is the way they speak, some may not speak but they will sing nicely. That is their auditory stimulus. They listen to music, they listen to the recorded songs, they imitate that song. So I know a couple of them who are good singers, but they will not talk. Why ASD specific dental care matters? Because they have high health risk. One is because of selective eating. They don't eat all, because texture, touch is also a sense which they don't like that kind of a food, then they will not eat that. Okay? So whenever you are using your instruments, your materials, your rubber dam, your cotton roll or your water spray, all these things are touching the child's mouth. So if any of them texture of these materials is not liked by the child, they will definitely not cooperate for your treatment. So that texture is also very important when you are trying to treat them. They have brushing difficulties, again with sense of touch. Brushing difficulties is again with sense of the taste of the paste, the smell of the paste, what you are using, all those things matter. Then their effects of medication, they usually drool a lot. They have a lot of other medications which is taken by them for controlling their behavior. So those things will have side effects which will reduce the production of saliva, which in fact affects the tooth. When the saliva reduces, it causes xerostomia, the caries rate also increases, the periodontal disease also be higher. Sensory sensitivities, like I said, light, sound, smell, texture, all these things can cause distress and non-cooperation. There are communication barriers. Definitely you cannot communicate with the child with autism unless accompanied by the caretaker. They know better than you. Always involve them before, during and after the treatment. It's very important. I want to ask one question to you all. When do you schedule an appointment of such child? Any child for that matter, especially child with difficulties or disabilities or special needs children, other than autism also, when do you want to schedule them? Good sleep after sleep. Yeah, that's what the first time when I told, treat them as you are, right? Why do you want a special time for them? Why do you want a special appointment for them? Or unless you incorporate all those things in your clinic and be ready, try to treat them as and when they arrive. This is what I learned through that course. They don't need special time, they don't need special appointments. They are like our every day, every patient. Are you sending any patient because you are old? Are you sending any patient because you don't have a wisdom tooth? No, right? Same way, they are different, that's it. Try to incorporate them in your daily practice. Let them interact, your patients, who are waiting in the area, let them interact with everyone. Just make sure that your team knows about them so that they are taken care when they come in. Okay? Preferably, if you want, you can schedule an appointment like any other appointments, like for RCT or giving special schedule timing. Like when for examination, be ready to examine at any time. For treatment, you can schedule, right? So that means you need to equip your clinic with small gadgets or some equipments which will make them feel better for examination, right? They require adaptive behavior guidance, desensitization, definitely yes. These things are from the behavior management things. If they don't like something, you desensitize them and try to introduce that kind of an environment to them. Visual schedules, structured routine will improve outcomes. These people have, once they learn something, they want to repeat the same routine. Okay, if they are coming and sitting on the chair, if you are going to first raise the chair, then move the chair backwards and then switch on the light, next time when you repeat this in the other order, they may not like it. So they need repetition in the same order. So when first time when you have taught them something about sitting in the chair or doing the examination or doing any procedure, do the same every time. If you are going to change, they are going to get startled, they behave the different way. Okay? And ethical and inclusive care, this is what said, inclusive care, they need not be discriminated, they need not have any special time, they have to be included in your routine as and when they come in. What are the common challenges? What you see mainly is bruxism. Most of them have bruxism because of their habits, parafunctional habits. This is like they learn few habits, oral parafunctional habits during the development, and they continue to do throughout their life. One of that is bruxism. If they have learned bruxism, it's very difficult to stop them from that. Similar way that causes tooth wear, TMJ strain and soft tissue trauma. Like any other bruxism, you are going to treat them. Only thing, the method, the environment in which you are going to treat going to change. Then increased care risk, as I said, is because of the diet, their preferences, then their texture, taste and smell, all those matters. So they will be, if you see a particular child with autism will be preferring one type of food even though it throughout the day actually. Okay, you cannot stop them from eating that because they have learned that habit. And pouching the food is very common because that is because of their habit. Sensory processing issues. Some children will have aversion to toothbrush, the toothpaste structures, taste, smell of toothpaste. Most of them have gag reflex. Oral hygiene limitations depend on the caregivers. Caregivers are not always there full time taking care. They also have their own life. So depending on that, their oral hygiene will also be affected. The resistance to brushing, if they don't have the idea of brushing and keeping the mouth clean, how they are going to implement that to the child, especially if they are from the low economic, socio-economic status. And poor manual dexterity. Functional behaviors, as I said, drooling, tongue thrusting is very common. Self-biting and biting other objects, pica, okay, PICA. All those things are also seen, which in turn affects the oral cavity and the teeth and the surrounding tissues. These are common oral conditions what you see in children with autism. Coming to language problems, obviously there is delayed or no speech. Sometimes they start speaking at the age of 8 or 10, but not full vocabulary will be established. Only few things they can learn and they will be keep on repeating that. And sometimes they don't speak at all. Then that is going to be a challenge when you are going to treat them. They may understand what you are telling, but they may not reply. There is limited vocabulary, as I said. Then there is something called repetitive speech or echolalia. They keep on telling the same thing again and again. So that is little annoying when we see them for the first few times, but once we get used to it, we can get, that's what you said, you should not see them differently. That is how they are. Then you have children may repeat words or phrases heard from screens without understanding their meaning. This is also a plus point when it comes to singing for them, right? They keep repeating. Then impaired listening skills, a lack of interactive dialogue may hinder the development. They never interact. Behavior challenges, they are hyper, they are impulsive, difficulty to sit in one place, impulsive behavior is there. Uh, Meltdowns happen very frequently, tantrums, all those things will happen. So the appointment time is to be very less, and appointment procedures, if it is a small procedure, you can do it in the clinic, and especially depending on the quantum of work and severity of disease what you have. That is, if it is multiple caries and root canals or extractions have to be done, it's better to get them into the GA, get it done. Before getting into the GA, try to accommodate in your clinic, because they need to come after. It's not one time job. GA is not a one time job. They have to come after for routine care and prevention. Okay, I think most of them I have repeated already. They don't connect with the world. So what are the unique challenges in managing these children? Most of them I have told. I am going to repeat the same thing because I am also autistic. Okay, communication barriers, limited language skills, poor receptive language and non-verbal behavior. Coming to behavioral challenges, the same things. There is sensitivity to light and sound, aversion to touch, gag reflex, anxiety and fear. They have more anxiety than anybody else. Short attention span, hyperactivity. So what you can do? This is what my take home message. Design your clinic, or if you already have a clinic, try to modify it with including such things like that, what you can, that all senses can be incorporated. Try to incorporate the concept of sensory adapted dental environment, which itself is a one-day lecture, how to use senses in your clinic. Okay, have shorter frequent appointments, gradually acclimatize the child, and don't think that you can definitely make them cooperative. Out of 10 children with autism, you can make 1 or 2 cooperative to that day and that for that procedure. That's it. If you have made that, that means you are successful. Not every visit is the same, not every procedure is the same. Same child can behave differently in the same environment. So quite challenging. And if failures do happen when you are treating such child, you may think that today I am equipped with such things, the child is going to walk, I am going to do a good job. But it doesn't happen that way. Okay, so you may fail treating them most of the time. So don't get disheartened or anything. Try to find out any ways how I can modify my approach and try to. It's not a single day job. It is a continuous process. Involve parents. They are the most, or caregivers, I would say. Most of the special needs children, sometimes they are left. The parents, either they don't survive, they will not be there, or they would have left in some daycare or some home like that, especially those who are poor. So try to involve the caretaker. Because I am in college, I get to see a lot of such patients, that's why. And don't hesitate to use pharmacological techniques like your GA for extensive or infection control, I would say, because infection has to be controlled. Dental caries is also an infection. Once it goes to the pulp, it is an infection to be controlled. Controlling infection, you need immediate care. So try to incorporate your GA and try more than this, be open-minded to seek help. Seek help from those who are specialists, who definitely 1 or 2 times they will give you some points which you may not have thought what it is before. This is creating a sensory friendly environment. Okay, this is one of the SAID clinics in India only, and that is sensory adapted dental environment. There is, what is the difference between Xerox and photocopy?
Xerox is the company
Yes. And photocopy is the one which you are using. SAID is photocopy. There is another name for it called Snoozalin Room. That is a brand. Okay, it's called Snooze-alin. Snooze means sleeping. Snoozalin Room. You may come to these terms very often in the future because I have told and sensitized you about this topic now, and all your phones are listening. Okay. So next time when you are opening, your Instagram reel may show all those things. Okay. So these are snoozling rooms by adjusting the light, dimming the light, use of task lighting. Task lighting is that focused light only for that area. Then offering sunglasses, light shields if they are very much not. I think most of it will also apply to your adult patients or any other normal patients in your clinic. These are small things which we are, when you start using it for the special children, you will try to use it for the normal or regular patients also. Controlling the auditory stimulus of dental equipment, minimizing the sound sensitivity, adjusting the touch. Okay, there is something called weighted blankets. Okay, weighted blankets are used to control their movements. When they are sitting on the chair, you just, it's a heavy blanket, it's a special blanket, you just put them on top of them. They feel that it's more comfortable. They use it at home also. When their activity is too much, these parents are advised, the trainers will ask them to put it so that their activity is controlled. You can use that also. Visual and environmental comfort, tactile friendly tools, providing sensory breaks. That's very important. Time out, right? When they need a break, you have to give a break. Okay, sometimes the parent will easily sensitize that he is going out of way. Immediately they will tell you that he is needing a break, so they will take them outside. So you also should be able to judge that. It comes with experience and try to give the break. Temperature is again very important. Don't, sometimes they may not like AC which is running like this. Okay, so I think we are also. Right, I can feel that. Tailored waiting room experience. Okay, you can have a section in the corner or something which there are some activities for them. More important is preparation and desensitization visits. Don't treat them in the first visit. If there is a call or an inquiry about such children, you make them understand. First you understand and try to desensitize the environment by bringing them often or making them to, usually the parents are advised, their trainers will advise them to show some videos about dental treatment. All those things will happen. Try to be familiarized with that. So together we can make dental care accessible, right? It is not a limitation, it is a different way of experiencing the world. A small thoughtful modification can create big differences, and every child deserves a positive, fear-free dental experience, and every one of us has a role to play in it. I hope you are enabling confidence, trust and lifelong oral health for such individuals, and let's build clinics where every child feels understood, safe and welcome. See, for sedation, especially with nitrous, even for normal adults or children, first they have to take up that hood and place it in the mouth for at least 2 to 3 minutes to inhale the gas. If you can achieve that, you can do it for anybody. But that's the attention span.